gentle disclaimer to all of our listeners. All medical information mentioned in this podcast is purely informational. It is not individualized medical advice. Please follow up with your physician or medical practitioner for individualized care specific to your needs. Thank you. Hello, everyone, and welcome to the Know and Do Better podcast. My name is Dr. Melanie Carminati, and I am your host. Today, I am very excited to talk with Dr. Kimberly Fishbach. We'll be chatting today about emotional release in our physical bodies. First off, for those listeners who don't know Dr. Kim Fishbach, she is a clinical psychologist and an expert in using integrative psychotherapy methods and hypnotic techniques for addressing chronic pain, anxiety, depression, ADHD, and trauma. She draws from her extensive training in CBT, DBT, mindfulness, hypnosis, and other evidence-based approaches to customize her clients' therapy and promote the most effective therapeutic outcome. She works collaboratively with her clients to set goals, address roadblocks, and develop feasible solutions and skills to improve their quality of life. And she is currently working out of New York Health Hypnosis and Integrative Therapy. Dr. Fishbach, thank you so much for joining me today.
Thank you for having me.
So I'm going to set the scene for our conversation because it comes up a lot in my own physical therapy practice. As a physical therapist, I utilize different holistic techniques. Some of the osteopathic hands-on techniques that I utilize are visceral manipulation and craniosacral therapy. These techniques themselves utilize very subtle energy paired with specific hand placements and specific direction of light force via the hands. What I found, and what the founders of these methods, Jean-Pierre Barral and Dr. John Upledger, is that the limitations that we can feel with our hands and organs and the limitations in different craniosacral movements is linked many times to specific emotions. For example, if there's a limitation in the innate mobility and motility of the kidney, this often is linked to unprocessed deep fear and grief. Since I'm a physical therapist, if any of these things come up in sessions with my patients, I'm always directing them to psychologists and psychotherapists like Dr. Fishbach to assist in the emotional processing. So Dr. Fishbach, can you just help us set the scene even more with what unprocessed emotions are and what you've experienced with your patients?
Yeah, so I think in order to answer that question, it's first important to know what is an emotion. A lot of people think that's such a basic idea, but it's actually something that's very hard to identify for a lot of people. And I mean, what emotions are physiological sensations that our mind then puts meaning to, depending on whatever situation is happening. And they give us important information about our internal and external world and environment, which then help us navigate future situations and help us figure out ways to most effectively meet our needs and evolutionarily speaking, help us survive. Emotions are very important for that. So when I talk to patients about unprocessed emotions, it's usually referring to feelings from the past or present that have gone on it that aren't acknowledged. They haven't been addressed appropriately or effectively or addressed at all, or they're just not understood, which could then prevent someone from taking the necessary steps to meet a very important need that might be missing.
And do you find that recognizing the unprocessed emotion is quote unquote the challenge for most people? And then how do you work with patients who are having difficult emotions that are unprocessed?
Yeah, so I would say that that's definitely a major challenge, especially because we don't just have one emotion. There could be multiple emotions happening simultaneously. And until the primary emotion is addressed, it's likely for there to be lingering feelings or sensations that begin to manifest themselves in different ways or they become stored in the body. And I'll have patients who say, well, I am identifying it. I feel angry, but so now that I identified it, why am I still angry? And I'll say, because maybe that's the secondary emotion. The primary emotion might be sadness or feeling hurt. And then that's when the real processing begins, when they could truly identify what is going on. I do notice also that a lot of my patients are fantastic at feeling thoughts. They'll say, I feel like my boyfriend doesn't like me anymore. And I'm like, okay, well, that's a thought. What is the actual feeling? What is the emotion underneath it? And that's where they usually get stumped.
Mm.
So emotions are very hard to identify. Um, and another common challenge is sitting with the emotion. Oftentimes, when they sit with the emotion, it's the first time they're doing it in a very long time for the length of time that they're doing it, because there's a reason that it's gone unprocessed. It's an uncomfortable emotion. They don't like sitting with it. And who wants to be uncomfortable? So we avoid, we suppress, but then that causes it to build up. When patients have difficulty sitting with an uncomfortable feeling, it makes it harder to then address and process.
And you mentioned physical sensations. Do you find that certain emotions are linked to certain physical sensations or like certain body regions? And is that sometimes easier to identify for people if they're like, oh, I feel this in my chest and this is that emotion?
Yeah. So if we think about anxiety and depression,
Mhm.
oftentimes when patients come to me and they tell me what symptoms they're having, they'll say, I feel lethargic, or I feel shaky, or my heart is racing. So a lot of those physical sensations are usually easier to acknowledge. They often just don't know why they're happening or why they come up when they do. And so through just observing this sensation and not judging it, because oftentimes people will look at the sensation and say this is bad or this is a good sensation, and when they're judging it, it makes it harder to truly look at what it means and what message it's giving us. So a lot of those sensations are often associated with anxiety. I see a lot of migraines usually associated with anxiety. When I have patients who have pain in their shoulders or their back, a lot of that stress, you hear the organ language of, I feel sick to my stomach, or it feels like the weight is on my shoulders. That says something. It shows that that pain is emotionally triggered. A lot of people with fibromyalgia often are depressed. Another person I've seen with depression had functional movement disorder where she was completely debilitated, and a majority of it was psychosomatic. It really does show how the mind and body is connected, and there sometimes are common patterns in the way that that presents.
And in regards to emotions, you mentioned, is that the secondary emotion or is that the primary emotion? Is that essentially the emotion is unprocessed or you're distracting yourself in some way from feeling it? Does it then kind of accumulate? Do like other emotions layer on top of it?
It doesn't mean necessarily that if you don't address one, another will come up. But I think more so that all of these emotions interact in some way. And so when one feeling is felt, sometimes that primary emotion is difficult to confront due to trauma, due to maybe in the past experiencing that emotion was discouraged or really painful. So it comes out in another way.
I see.
And the interaction of these different emotions can be very confusing.
I know for myself, I am very much educating patients about the mind body connection. I use Pilates as the main movement re-education, which is all about breath and breathing. And there's tons of cues with inhaling and exhaling and just body awareness. So I see it, in my patients. And I mentioned in the beginning the organs manifesting, organ dysfunctions being linked to different emotions. But you already mentioned fibromyalgia, and I see those somaticized painful experiences in many of my patients. You mentioned the pain patterns. Do you see some pelvic patients, and what emotions do you find?
I would say I had a couple patients, one in particular that comes to mind that came to me specifically for pelvic floor dysfunction. And there was a lot of stress within the relationship in terms of the negative self-talk that he had. A lot of it was related to anxiety.
Hmm.
And once we were able to address certain coping skills, take away the emotional charge associated with some of the language he used and self-talk, that stress reduced, and the distress associated with the pain also reduced, and in turn his subjective level of distress went down on its own. So he went from a pain intensity of like a 9, and by after a few months, maybe 3 or 4 months, he was at a 2.
Amazing.
And then we just worked on the anxiety.
Do you ever refer to physical therapy for the patients who are experiencing physical pain?
Absolutely. I would say that actually a majority of my patients see a physical therapist simultaneously. That movement, continuing to stay active, not overactive, but in a way that doesn't cause any sedentary actions where they're just sitting around and not using the muscle, because then that can cause more pain when they start to use it again and cause that vicious cycle. And I found that the patients that had the most success saw physical therapists simultaneously.
So I don't know in the psychology world, but in the PT world, we utilize the biopsychosocial model when we educate patients who are experiencing pain about the painful experience, and then that whole trifecta and the three things that really are creating the painful experience. I have on our YouTube, on the Inspira Physical Therapy and Pilates YouTube, I did a free lecture about the biopsychosocial model and about all the details surrounding the sensory homunculus and neuroplasticity and all of that jazz, because it's important to understand the science of it. I don't want to take this podcast into a whole pain science direction, but I just wanted to mention it because it is important to know that there's three things. If you are an individual who's in pain, there's biological considerations, what is physically or mechanically injured, psychological consideration, and sociological considerations. So, which is why, as you already mentioned, many of your patients are seeing a physical therapist and seeing you. And the same goes for most of my patients too. If they aren't already seeing a therapist, we talk about it right in the beginning, just so we set the scene, because everything needs to be addressed really to give that holistic care that the individual needs to get better and to move along in their rehab.
Yeah, exactly. When I teach my patients also the biopsychosocial model, we talk about how our behavior can open and close the pain gates that may exacerbate pain without even realizing it. And that is where oftentimes the physical therapy comes in, where I'll say, are you doing that movement? Are you making sure you're doing your homework, in between your physical therapy sessions and psychology sessions? In addition to that, we talk about different strategies that doesn't have to do anything with psychology, but is just, do you have a pillow to prop yourself up so you're not in pain? Some of those basic things that can also affect someone's experience of the pain. And when they realize that there might be a simple solution, it can significantly reduce their distress.
Let's say that someone processes those emotions. What happens? What's the journey once they start processing? Are there more emotions that just pop up?
So when they start to resolve some emotions, they then it's sort of like peeling back the layers. So we might address one thing, or we might realize that something else is causing distress that they didn't realize. And then we start processing that emotion. And when they start understanding and able to identify where their stress comes from, that in itself just makes them feel so much better and relieved, and literally and figuratively takes the weight off, and they feel lighter. They are able to have a little bit more movement because there's less tension in their body that they're holding from all the anxiety and stress. And so physically they are more limber. And so when they experience that, because a lot of the distress associated with the pain contributes with their perception of the intensity of the pain, they will also start to experience less hurting. They'll feel less discomfort. And that is amazing from the therapist side to see. So.
Absolutely. We love when our patients are doing well and empowered in
Exactly. I mean, I've one case study where I think my most miraculous recovery that shows how when emotions release, it completely can change somebody, is that I had a patient with functional movement disorder who, I think, as I mentioned before, who was completely debilitated. And after a year, she was in a wheelchair. She occasionally used a walker, but was mostly in a wheelchair, couldn't drive, lived with her parents, had a son that she could she was very depressed. And she felt like a burden, all the things that a lot of people with chronic pain experience.
Mm-hmm.
After a year of psychotherapy and physical therapy, she was driving again. And that was the case where I was like, this is amazing. Like, this is amazing work. And if there's anything to show that the mind and body is related, that is it.
We didn't explicitly mention yet, but there are obviously some health disorders, and sometimes people are on other medications that can make it challenging, right? To work through.
Mhm.
Can we touch on that a little bit?
Sure. Certain mental illnesses that can make it more difficult to process emotions. The first thing that comes to mind is people on the autism spectrum. Oftentimes they have difficulty identifying emotions. They have difficulty labeling them, even realizing that they are experiencing an emotion until they just feel very irritable. There's also dissociation, which can be brought on by trauma. So there's a spectrum within the trauma field, but when people start to dissociate, it's usually because it's due to avoidance, and avoidance so much that they literally separate themselves from their body and mind because the experience is too painful to confront. In those cases, it does become a little bit more challenging. And then psychosis. Psychosis is something that is often, or is a mental illness that's difficult to work with because we don't know which reality we're often working with. And are their emotions in line with what is being created in their mind? Is it based on reality? And everyone's emotions are valid. It's just difficult to assess what is it that they are able to, what is it that we're working with? What situation, what trauma. It's often they're also not stable enough. If it's severe psychosis, they need a lot of medication in order to control their emotions or stabilize enough to have a session. The medications they're on can in turn also blunt their emotions. Again, I have worked with people with psychosis, but it definitely makes it more difficult.
So what's your guidance for people who are experiencing chronic pain or emotional challenges? How can someone get started when they feel overwhelmed by their emotions or just the experience of pain? How can they start their journey towards healing?
Yeah. Well, so I think, when somebody is experiencing pain, the first thing they must do is go to a doctor. They have to make sure that there isn't actually something medically wrong with them before they seek help for chronic pain management, where we're addressing the psychological factors, because we don't want to ignore an actual medical issue if it's there. So oftentimes when I see people for chronic pain, it's important to get a medical referral to say, okay, this person has this, but overall they should be healing. They're still experiencing this pain. You can take it from here, kind of thing. And then I work in conjunction with the doctor. And when people get to the point where they're just so distressed about the pain itself, then that's where seeking psychological help could definitely come in handy and help them with acceptance of the pain, as well as addressing coping skills and anything that might be getting in the way of feeling full relief. Because again, the mind and body are very connected, and oftentimes there are stressors that can intensify our perception of the pain and increase tension in the body and in our organs. And by addressing, relationships, or addressing how people deal with anger, or addressing automatic negative thoughts, anything that is emotionally charged can be worked with and then addressed and alleviated there, and then alleviating a lot of the pain as well.
Awesome. Any final remarks before we close up our conversation?
Yeah, well, I think if there's anything I learned about how people relate to emotions is that people often judge them as good or bad. And I would say I would want people to know that our emotions are important, they're helpful, and they deserve to be listened to, and they don't have to be scary. They just give us information that helps us navigate the world and meet needs. And if we listen to that, then we could then take the appropriate steps to feel more fulfilled in our life.
Amazing. Dr. Fishbach, thank you so much for joining me for this educational conversation. Thank you everyone for tuning in to listen. Please spread the word about everything that we spoke about, and join me next time for another informational conversation. Thank you.